The global landscape of public health is facing a quiet but significant shift as tracking systems record an uptick in hantavirus infections across multiple regions. This surge is prompting intensified scrutiny from epidemiologists and health agencies who trace the root of the problem to accelerating global climate patterns. Hantavirus represents a category of rodent-borne viruses that can cause severe, often fatal, respiratory or hemorrhagic conditions in humans. It does not typically spread from person to person, but rather enters human populations through environmental contact. The core of why this development demands international attention rests on the direct link between shifting weather extremes and animal biology. As global temperatures fluctuate and weather patterns become increasingly erratic, the natural habitats and food supplies of specific rodent populations are undergoing drastic changes. These environmental shifts trigger population booms among carriers, drawing them into closer, more frequent contact with human settlements. Understanding this dynamic is no longer just an academic exercise in ecology. It has become a pressing priority for clinical surveillance and municipal planning. The baseline threat of hantavirus is tied directly to how these animals interact with their surroundings. When wild rodents thrive due to altered seasonal cycles, the risk to human communities rises proportionally, forcing public health systems to adapt to a threat that changes alongside the weather. Investigating the mechanics of this surge reveals a complex chain of custody involving international health surveillance bodies, research laboratories, and regional clinics. Field reports and ecological studies indicate that milder winters, followed by prolonged, intense wet seasons, create ideal conditions for high-yield vegetation. This abundance of food leads to what biologists call a rodent mast year, causing an exponential spike in the carrier population. Specialized laboratories monitoring these trends analyze blood set and genetic sequences from trapped rodents to track viral loads and geographic spread. At the clinical level, medical facilities in affected zones are being advised to maintain a high index of suspicion for patients presenting with sudden fever, severe muscle aches, and acute respiratory distress. Diagnostic confirmation relies heavily on specialized serological testing and polymerase chain reaction assays conducted in biosafety-level laboratories, as early symptoms closely mimic more common seasonal illnesses. A critical point of contrast for investigators is distinguishing between localized, expected seasonal fluctuations and true climate-driven expansions into new geographic territories. While some local agencies initially attributed brief spikes to normal cyclical patterns, broader datasets from international monitoring networks suggest a more sustained and widespread geographical migration of the virus. Surveillance teams emphasize that shipping, trade, and agricultural transport routes can also intersect with these migrating rodent populations, potentially introducing carriers into suburban and urban transit hubs where they were previously undocumented. Addressing the long-term management of this public health challenge requires a combination of strict environmental surveillance, robust infrastructure maintenance, and clear public guidance. Standard prevention protocols focus heavily on reducing human exposure to rodent excreta, which is the primary vector for transmission. Health authorities advise that cleaning potentially infested areas should never involve dry sweeping or vacuuming, as these actions stir up infectious aerosols into the air. Instead, the use of disinfectants and wet mopping techniques is universally recommended. On a broader scale, municipal guidance emphasizes rodent-proofing homes, securing food supplies, and managing waste effectively to eliminate harborages. Despite these established protocols, significant gaps in knowledge persist. Scientists still face uncertainties regarding how rapidly different strains of the virus might adapt to changing vector species, and predicting the exact trajectory of future outbreaks remains difficult due to the volatile nature of climate modeling. Public health agencies continue to stress that while the current surge requires heightened vigilance and systemic upgrades to regional monitoring, there is no cause for widespread panic. Enhanced laboratory capacity and proactive community awareness remain the most effective tools to mitigate the risks associated with this climate-linked environmental shift. For more detailed breakdowns on emerging global health reports and analytical updates, consider subscribing to this channel. The operational response to this rising biological threat involves an intricate network of international health surveillance agencies, university research laboratories, and frontline medical clinics working to map the changing viral footprint. Field data collected by ecological monitoring stations show that the surge is heavily driven by a phenomenon known as environmental masting, where unseasonable rainfall patterns and extended growing seasons trigger a massive overproduction of forest seeds and agricultural vegetation. This sudden abundance of nutritional resources leads to a rapid contraction of normal winter die-off rates among rodent populations, resulting in explosive population spikes that overflow from wilderness areas into rural and suburban properties. Specialized virology laboratories are currently processing thousands of blood and tissue samples from field trapping operations to measure changes in viral prevalence within these expanding animal reservoirs. For medical professionals working in newly affected zones, hospital networks have updated their diagnostic protocols to ensure that clinicians do not misidentify early-stage hantavirus infections, which frequently present with non-specific symptoms such as sudden onset of high fever, deep muscle aches in the large muscle groups, headaches, and severe gastrointestinal distress. Because these symptoms mirror common seasonal influenza or other viral infections, definitive diagnosis depends entirely on laboratory confirmation using enzyme-linked immunosorbent assays to detect specific antibodies or real-time polymerase chain reaction testing to isolate viral ribonucleic acid. This laboratory infrastructure faces a dual challenge. They must accurately process urgent clinical samples while simultaneously sequence the virus to detect any genetic drift that might alter transmission dynamics. A key point of contention among public health investigators involves contrasting historical baseline data with current infection maps to determine exactly how much of this surge is a temporary cyclical spike versus a permanent geographic expansion driven by altered climate zones. While some regional agricultural boards initially argued that the increased rodent activity was a localized short-term nuisance, centralized epidemiological data from multinational health organizations confirm that the virus is establishing itself in higher latitudes and altitudes where the winters were previously too harsh for the host species to survive the non-breeding season. Furthermore, logistics experts and transport authorities are being integrated into the surveillance framework to monitor shipping corridors, grain storage facilities, and international trade routes. As the migration of infected rodent populations toward human food infrastructure increases the risk of carriers entering container ships, rail networks, and cross-border commercial transport hubs. Managing the long-term impact of hantavirus in an era of shifting global weather patterns requires a rigorous adherence to established environmental hygiene and standardized public safety protocols. Because the primary route of human infection occurs when dust and air become contaminated with microscopic particulates of rodent saliva, urine, or feces, the methods used to clean affected spaces are critical. Public health departments universally warn against dry sweeping or vacuuming in areas with known rodent activity, as these actions forcefully launch infectious viral particles into the air where they can be easily inhaled. Instead, the standard protocol mandates thoroughly soaking the entire area with a commercial disinfectant or a diluted bleach solution for at least 5 minutes to deactivate the virus before wiping or mopping the area clean while wearing protective rubber gloves and respirators. For long-term prevention, municipal guidance focuses heavily on structural exclusion, which involves sealing any entry points in homes, agricultural sheds, and storage units that are larger than 1/4 of an inch, using durable materials like steel wool or concrete. Additionally, removing outdoor harborages by clearing dense brush, elevating wood piles at least 1 foot off the ground, and securing all domestic trash and animal feed in airtight plastic or metal containers serves to cut off the resources that attract wild rodents to human dwellings. At the systemic level, environmental surveillance programs are working to expand routine tracking from traditional rural zones into urban fringes and developing suburban spaces, utilizing ecological data to predict localized population booms months before they manifest as clinical emergencies. Despite these structured mitigation efforts, significant boundaries in scientific knowledge persist, as researchers face difficulties predicting exactly how ongoing habitat fragmentation and volatile precipitation cycles will influence different strains of the virus, particularly regarding the long-term behavior of rare strains capable of human-to-human transmission. Ethically, the current surge serves as a clear reminder that public health is permanently linked to the stability of our shared global ecosystem, requiring an active shift from reactive emergency medical responses to proactive environmental stewardship and sustainable land management. Maintaining a grounded, vigilant approach to personal and community sanitation remains the most reliable strategy to minimize exposure risks and safeguard